Today on the Why Act Your Age podcast, we're going to be talking about age-related muscle loss and things you can do to help minimize it and stay as strong as possible. But first, I've got to read a 40-second disclaimer. Dr. Naomi Albertson is a physician at the Reno Orthopedic Clinic and the owner and developer of Dr. Nye's OC2, a bone health and muscle strength supplement for adults age 35 and older who want to stay active. The information in this podcast is intended for your general information only and is not a substitute for medical advice, diagnosis, or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem or disease. Always seek advice from a healthcare provider with any questions or concerns you have regarding your health, and never disregard professional advice or delay seeking medical treatment because of something you hear on this podcast. Dr. Naomi Albertson and Dr. Nye's make no representation and assume no responsibility for the information in this podcast, and such information is subject to change without notice. Hello and welcome to the Why Act Your Age podcast with Dr. Naomi Albertson. My name is Rob, and Dr. Albertson and I are really excited about this inaugural episode of the podcast, and we're glad you can join us. Before we jump into today's topic, which is age-related muscle loss and ways to fight it, I want to quickly detail the types of things we'll be talking about in this podcast. We're going to focus on all things related to staying active as we get older. So things like keeping muscles strong, bone health, nutrition, exercise, injury recovery and prevention, and other topics Dr. Albertson has spent her career focusing on to help keep people moving, active, and doing the things they love. So whether you're a weekend warrior, maybe you're in a physically demanding job, or you just want to feel and stay as strong as possible as you get older, we really think this podcast will bring you a wealth of really great information. Dr. Albertson, or Dr. Nye, as those of us who know her call her, is a board-certified sports medicine and family medicine doctor practicing at the Reno Orthopedic Clinic. She treats people there for a variety of injuries, and she treats people ranging from everyday folks like myself all the way up to professional athletes. She's a graduate of Tufts University School of Medicine and did her sports medicine fellowship at Stanford University. So, welcome to the podcast, Nye. Maybe you can tell us briefly a little more about your background and how you became interested in aging and maximizing what people get out of their body.
Sure. Well, so first of all, thanks for having me. I'm excited about this podcast. I think to start, I would have to start at the beginning, honestly. So when I was growing up, I was an athlete myself and primarily did gymnastics and tennis, and then did a little swimming in the summer. But I was pretty competitive, and then ended up competing in college as well for gymnastics. And I think just being active throughout my life has sort of given me, just interest in staying active. And I, especially in college, really kind of honed into the performance advances that were out there as far as maximizing nutrition, improving recovery with rest, and that sort of thing. And it just piqued my interest. And I ended up in med school. I thought that I would go into, some sort of, orthopedic surgery or surgical field. But when I got my arms around the idea of exercise physiology and sports medicine, that was really the thing that caught my attention the most. And so I ended up doing a family medicine residency and then ultimately a sports medicine fellowship, which is just another year after residency. And then I started out in private practice up in Marin County. Ended up finally back in Reno, where we've been for about 7 years. So I am at the Reno Orthopedic Clinic, and I get to see all sorts of patients there, but primarily, focused on sports medicine.
Gotcha. No, that's really interesting. I know you always express a strong passion for keeping people moving and keeping people active. And I know you're a frequent lecturer on a range of sports medicine topics. And there's also some videos on YouTube, and later we'll let people know where they can find those. In addition, we should point out right off the top, full disclosure, you're also the developer of Dr. Nye's OC2, which is a frame sports supplement for helping adults stay active with age. You can find out about that if you're interested at boneandmuscle.com. And I work with Dr. Albertson on that product, but it's not the subject of this podcast. But like I say, you can go online and find out more about it. So let's just jump right into today's topic, which is age-related muscle loss. It's not something people think about very often, and I think it sneaks up on people as they get older. And I know that from personal experience. But tell us a little bit about what people need to be thinking about as they get older in terms of when does muscle loss start, what's exactly happening to our aging muscles, and then after we talk about it a little bit, we can talk about ways to sort of offset muscle loss.
That sounds good. So muscle is not really something we think about because we take our muscles for granted, honestly. Some people think about their muscles a lot. Exactly. We don't really pay attention to them until we're weak and we can't do the stuff we want to do. But that being said, I would say, with my focus in sports medicine, I've always been, in my career working with younger athletes who are hyper-focused on strength and specific training to maximize their performance. So that being said, we've got this subset of people out there who are really focused on maximizing strength and function and performance. And then we've got, the rest of the population, which is most of us. And I think that, the reality is that based on the research, we start losing skeletal muscle, so muscle strength and muscle bulk after about the age of 35. So most people are not going to notice that immediately. What you're going to notice is that you're losing just a little bit. And maybe by the time you're in your mid 40s, 50s, all of a sudden stuff's harder. And I hear it from my patients all the time. They're like, I got this 10-gallon, tree that I want to plant in the backyard and I couldn't get it out of the truck, right? Or I wanted to, go on a trip with my grandkids and there were 6 flights of stairs and I had to take 2 breaks, right? And so, it's interesting because we don't really think about it as, oh, I'm losing muscle, but over time we see those changes as being really, impactful on your lifestyle. So, I think to answer your question directly, Rob, I think, we do start seeing muscle loss, and that's what's been shown in the research, that we lose somewhere around 5 to 8% per decade between the ages of 35 and about 55, 60. And then that rate of loss accelerates. And we all know that, right? Because of what I mentioned before, but also because, we have an elderly population out there, and we know that if grandma winds up, say, in the hospital, that her recovery time, which is definitely related to her nutritional status and her muscle tone and her ability to go back home, is, massively impacted by her muscle strength. And so, I think we all know these sort of anecdotal, stories about family or friends, but I think we don't really necessarily put it together for ourselves that we're losing muscle over our lifetime.
Well, I think most people, to interrupt you for a second, I think most people, when they think about muscle, they think about athletes or bodybuilders when you're talking about muscle building and strength and stuff like that. And they don't realize, like you say, that muscle loss applies to everybody. And it does. It Absolutely. Sneaks up on you. Yep. And this is the really scary part. I was reading a Harvard University article that was saying that basically the average person loses about 30% of their muscle mass over the course of a lifetime, which is amazing. When you put it in that, it's one thing to say 1% a year, or like you said, 5% or so a decade. But then when you see it, what that looks like over the course of a lifetime, it's scary.
Absolutely.
I think I've heard you say before that muscle loss isn't uniform either. Is that right?
Yeah, that's true. Yeah, it is true. It's really interesting. I think there are a number of published studies out there that show that, in particular, women lose more of their muscle strength in their lower extremities faster than their male counterparts. We lose a statistically higher percent of grip strength compared to our ability to, say, stand up out of a chair. And, it's just kind of interesting. The way that we lose muscle is not uniform. You're not just all of a sudden going to feel a little weaker going up a, flight of stairs and opening a jar, but it's stuff that's progressive over time. And we all know it. My sister the other day, who's, in her mid 50s, she passed me a jar and said, "Could you open this?" And I sort of laughed because I was like, yeah, I can still, thankfully. Right. But I think, it is one of those things that we do see and we notice, and it's, so impactful on our quality of life.
And the lower extremities is really important because you touched on it earlier. After age 65, I think the statistic I've seen is about 25% of people over age 65 suffer from a fall where they slip and fall every year. And I know some medical folks when I've read about it refer to it as a crisis, essentially.
Absolutely. I mean, we call it a silent killer. We don't think of falls as being so traumatic, but if you've known anyone in their 60s who's fallen, I mean, the resulting, whether it's soft tissue injuries like bruising or contusions or, hematomas, which are just blood clots under the skin, or fractures like bone breaks, these are significantly impactful events. And hip fractures in particular, I mean, are unfortunately increasing with an aging population with that persistent, fall risk. And so, we're seeing a lot of morbidity and mortality around not only falls, but their resulting fractures.
Gotcha. I have a question for you. What does morbidity mean exactly? We all understand mortality, but what is morbidity?
Yeah, morbidity is all of the things that are negatively impacted by a medical event. So like, let's say you fall and you break your wrist. Well, you're not going to die from a wrist fracture. But the problem is that now you're not going to probably be able to do all of your cooking and cleaning on your own.
Gotcha.
You might or might not be able to drive, right? So all of those things are considered morbidity. Yeah.
Okay. That makes sense. So when we're talking about, for instance, with muscle loss over a lifetime and it not being uniform and it, really in the lower extremities is pretty pronounced. I mean, this is part of the reason you want to keep yourself as strong as possible, starting in your 30s. It's, you want to have an active lifestyle, but there's also this payoff, so to speak, if you keep yourself in good shape and keep your muscles as strong as possible as you get older, and that you're less likely to fall, which I think the research shows that pretty clearly, right?
Absolutely. And I kind of, I always talk to my patients about it in the framework of, nobody's end of life plan is to be in a nursing home. None of us are angling to live in a nursing home for the last 10 to 15 years of our lives. We would all like to stay independent, hopefully in our own homes, hopefully able to take care of ourselves, at least in some capacity, right? Mm-hmm. Even well into our 80s and 90s, hopefully.
Sure.
And so, I mean, I think it's really important to think about your muscle strength because, even things that, we take so for granted, but like, I mentioned, going up and down a flight of stairs. How about leaning over to put your laundry in your washer or transferring it to your dryer or standing for a period of time to wash your dishes, right? Squatting down to get something from a low cabinet and then being able to get back up. I mean, these are all things that we just do every day and we don't even think about it because we have muscle strength. But as we age and we're losing muscle strength, those things become the reason why you can't take care of yourself or you can't live at home or you need help. And so I think, yes, you're absolutely right. Like focusing on muscle strength early in your life. So, whether that's through diet and exercise and whatever else, and then in your 30s, really paying attention to it and continuing to pay attention and do the things that you can do to maximize and maintain your strength are critical. And Rob, we're only touching on what muscle does for muscle or muscle, thinking about muscle. We're not even talking about the fact that muscle is one of the primary drivers for normal bone turnover, right?
Interesting, right?
Yeah. So, I mean, all these, issues with, like you mentioned, aging, falls, resulting fractures. I mean, so many of these issues that happen later in our life can absolutely be prevented if we focus on just maximizing strength earlier in life and again continuing to make it a focus in our 40s, 50s and beyond.
Yeah, no, exactly. And I sometimes think about when I think about this, I sometimes think about it almost like a retirement plan.
Absolutely.
It's something that you should be doing. Maybe I should go exercise today. I don't really feel like it, that kind of thing. But it is sort of, there's a payoff in the end. But you also, in addition to that, there's just, you want to be active as
Absolutely.
in your 40s and your 50s. You want to be able, maybe you're a runner, maybe you're a skier, whatever it is, you want to be able to still go out there and do what you like to do. Or you might be in a physically demanding job. Our UPS driver delivered something a while back, and he was complaining about how things are getting harder at his age. He was probably in his 50s or so. So I mean, it's a real thing, and people should think about it. So real quick, we're gonna talk about in a second, sort of. So now that we've sort of told everybody about what the big bad guy is here of muscle loss, we're gonna talk a little bit about ways to fight it. But I wanted to real quickly just in kind of general terms that are easy for people to understand, what exactly is happening to your muscle?
Such a good question. So really there are, a few different things going on with your muscle. Muscle is not a static object, obviously, in your body. It does have nerves that come to the muscle, and it also has blood flow that comes to muscle. And so, those two issues play into normal, strength and normal muscle firing, if you will.
Mm-hmm.
So as we age, our blood vessels can become compromised as well. That's cardiovascular disease or peripheral vascular disease that some people are fighting with high cholesterol, blood pressure issues, and that sort of thing. So that can have a direct impact on your muscles' ability to recover normally and to grow normally. The other thing that can be involved is nerves, right? And we know this just from, say, like somebody who is wheelchair bound or who has, nerve damage to their spinal cord. If they're not able to use those muscles, of course, those muscles get weak, right? So everybody's pretty familiar, I think, with that concept. But as we age, we know that we do have some nerve changes as well, and that can play into the muscle loss that's going on also. So not only are there these blood vessel changes and possibly nerve, related changes going on, but what's happening to the muscles themselves is that we actually get fatty infiltrates that kind of take over where our normal muscle cells were. And so we have less muscle cells, so less number of muscle cells. And then the actual bundles of muscle cells actually get smaller as well. So not only is our bulk decreasing, but our ability to contract a muscle group is also decreasing. So our strength is decreasing as well.
Okay.
Yeah, decreasing as well.
Got it. That's interesting. That's pretty. So essentially what you're saying is that there's issues with blood supply, it sounds like, right? And with nerves, and with the fact that our muscles are becoming sort of slowly infiltrated with, I think you were referring to it as fat deposits. Is that essentially correct?
Yeah, exactly. Yeah.
Gotcha. It's interesting. I actually saw last week a study that was talking about, it was looking at muscles. I think they were doing MRIs. I forget exactly, but they were looking at the muscles of young people, I think in their 20s, and older people, I think in their 60s and 70s. And they had basically tracked some athletes who were in that older age group over time. Uh-huh. And they found that their muscles looked a lot like a younger person's muscle, which they were really surprised by, because in general, like you say, you describe, if you look at the average 70-year-old's muscle, is going to be smaller
right.
than a younger person's muscle. So the caveat to this was that these were people, they didn't start working out in their 60s or 70s. They were athletic their entire lives.
Right. So, and also I would still argue that even though, and I saw that same study, even though they maintained bulk of the muscle, their ability to fire that muscle, so push the same amount, pull the same amount, sure, lift the same amount, decreased. Sure. So even though their muscle looked good, it still wasn't as functional as it was when they were younger.
Sure, and that's because, like you were talking about, with the nerves and the blood supply and stuff like that.
Exactly.
Okay, yeah. Gotcha. But still, they were stronger in general than their cohorts who weren't out exercising across their lifetime. So I find that really interesting. There's always new studies that are coming out about muscle strength in older adults. And like we talked about, we kind of briefly talked about it, but there are a lot of studies that show that even into your 70s, if you exercise, you can improve, you can actually gain muscle and slow muscle, well, gain muscle is probably not the way to say it, but slow muscle loss with exercise, even as an older adult.
Absolutely. I mean, I think exercise is critical. And that being said, it's not the only solution. And so I think, putting all these things together, that we're going to talk about here, I think are all going to give you some benefit. So, absolutely, though, exercise is critical.
Okay. So in addition to exercise, what else should people be thinking about as ways to sort of slow the progression of muscle loss as they get older?
Yeah, well, I talk a lot to my patients in the office about protein intake because protein is obviously something that we eat. It's primarily meat, but there are some vegetable proteins out there as well, like soy-based proteins. And I think that, the bottom line is that the recommendations for protein intake with age have increased over the last several years instead of stayed flat or decreased. And those recommendations, you can always find online, but the International Society of Sports Nutrition publishes their guidelines every year about recommendations for protein intake. And, it's always higher than what people anticipate. I mean, I get patients in the office all the time that are like, well, I eat healthy. And I'm like, I'm not talking about health. I'm talking about protein. And so it's always interesting because maybe they're eating a ton of vegetables and they are eating, a healthy diet of like lean meats and that sort of thing, maybe grass-fed beef and whatever, but they're not getting enough protein. And I would say, almost 10 times out of 10, like 9 times out of 10 for sure, that people, we do the calculations in the office to help them know, how many grams of protein are we going after a day. And again, based on the International Society's recommendations. And, they're low by like 20, 30 grams of protein. And they're floored. They're like, oh my gosh, like how come nobody told me this? How come I didn't know? So, yeah, I think protein is massively important. Not all protein is equal. I tell my vegan and vegetarian patients, it is your body was designed to absorb protein better from animals. And so unfortunately, the, vegan and vegetarian proteins that are primarily soy-based are just not as effective. They're still effective. They count. They're just not as effective as meat-based proteins.
So does that, on a practical level, does that mean if you're a vegetarian, does that mean eating more protein than the recommendations?
That's usually what I make a recommendation to do, just because I think the absorption is just not as good. Gotcha. Or supplementing their diet with, branched chain amino acids or something, another protein like powder or, some sort of non-meat based synthetic protein to get them up to the right amount.
Okay, that makes sense. Another thing also, I think don't your need for protein, don't your protein needs increase as you get older? You actually need more protein, right, as you age.
Yeah, they do. And it's really interesting. I think, there are, again, always published guidelines that you can find on your own that do change. So it's worth, getting familiar with whether it's the International Society of Sports Nutrition or the American Medical Society of Sports Medicine, so the AMSSM, their guidelines. But that being said, I think, yes, the overall is that as we age, we need more protein to minimize the loss that we've been talking about, right? And so, the problem with that is that our appetites tend to decrease with age and our activity levels tend to decrease with age. And so it's hard to, talk a 75, 80-year-old patient into eating, 80 grams of protein a day.
Right. It's a lot. I told my father-in-law recently about what the recommendations are for somebody his age. He's in his late 70s, and he was shocked because he thought, he thinks, well, I drink milk every day and I eat meat every day, and he thinks he's getting his intake. And we sat down and did the calculations, and he was doing about half of what he needs to do.
Right. And I think, Rob, you're sort of pointing out, the reason why there is a multi-billion-dollar industry out there of protein. Right. You can buy a, jar of protein just about every store you walk into now. And so, I think, I usually counsel my patients, like, do the calculation, look at what you're eating first to figure out, like, where do you fall? Like, are you low or are you okay? And if they're low, but they're only, say, 20 grams low, well, okay, then go to whatever your favorite supermarket is and buy a whole bunch of whatever, right? Bars, powder, goo, I don't care. Try them. And frankly, if you want to eat it as a food, like you want to eat steak every day, well, have fun, enjoy. But I think a lot of people just kind of need that, like, oh, like that's why these bars are out there that are 20 grams of protein. Got it. That's a good snack instead of my granola bar that has 0 grams of protein, right? So, definitely focus for sure.
Gotcha. Yeah, no, for sure. So that's interesting. So we talked before about, let's move on a little bit from, one last question on nutrition, actually. So you're talking about protein, and this is because protein, it builds muscle, right? I mean, that's in essence.
It repairs muscle and gives you the building blocks to build muscle, but you still got to do the exercise. You're not going to just build muscle if you're not doing anything.
Gotcha. And that was the next thing. I was going to jump back to exercise. What do you recommend to your? Do you have different recommendations for people of different ages when you're talking to a patient and they say, I want to get it, I want to start exercising again, or whatnot? What are the recommendations?
It's such a good question. So, unfortunately in my practice, I'm usually seeing people because they're injured in some way. So something hurts, right? Whether it's a shoulder or knee or hip or something. And so my recommendations are first to get the pain under control, get the problem sorted out. Sometimes that requires, medicine, sometimes physical therapy. And then once the pain is under control, then we actually progress to an exercise program. Now, exercise programs are not all created equal, and they are absolutely different for different age groups and for different sports, right? We know that from our young athletes and, again, our high-level elite athletes. They're doing sport-specific training. Like if you're a football player, you don't need to be, probably running, 20 miles every, a day. Sure. You need that, fast twitch sort of, strength training focus. If you're a cross country runner, you don't need quite as much of that strength training. You still need some, but you don't need as much. You need more of the aerobic or endurance training. So every exercise program is individualized and should be individualized, not only to limit around injury or joints that have had, you've had problems with, say, but also to maximize strength training without injuring, joints further. And that's the biggest difference I find with my older population. So again, anybody older than really 45, 50 is that, and I hate throwing myself into that category, but that being said, this population, anybody older than 45, 50, I think, we do need more focus on strength training. So specifically like weightlifting, small numbers of reps, not overloading joints, but, really going after specific targeted muscle groups. And, that's where having somebody with some knowledge to help you develop that strength training program really matters, whether that's a personal trainer who you've worked with before, who you trust, or if it's a physical therapist who has maybe somebody on staff, like an athletic trainer who can help transition that program for you, or whether it's, a coach or a strength conditioning coach or somebody depending on, again, your level of fitness and your commitment to your activities. So I think it's really critical that you get a good exercise program from somebody knowledgeable who is not going to hurt you.
Okay. So to sort of summarize, protein, exercise with the help of someone knowledgeable to start, and focusing on strength training to keep your muscles as strong as possible. Finally, let's talk about creatine, and just briefly because it's going to be the topic of our next podcast discussion. For people who don't know what creatine is, it's a supplement that helps boost muscle strength, and it's been used by athletes for a while, but some medical professionals like Dr. Albertson are seeing its potential to help people with age-related muscle loss. And again, full disclosure, Dr. Albertson and I both sell a supplement supporting both bone health and muscle strength that contains creatine. But let's talk just briefly about creatine now, because in general, I think most people don't get how creatine works. You don't take it and you magically get stronger. Unfortunately, you need exercise.
Wouldn't that be nice?
That
Yeah.
would be nice.
So it is funny. So I think you're right. I think, again, creatine has been in the sports market, as a supplement for over 50 years, but it has primarily been used by athletes, and athletes are very well versed in how to use creatine. It is never going to be illegal because it's in meat and it's naturally made by your body. And
it's not a steroid. I know
it's not a steroid, no,
right.
And it's not a performance enhancing drug, and it's not, a PED, right? That's what those are called. So,
right.
And it is never going to be banned because it's natural. So that being said, it's been known for, over 50 years to improve strength. And it works in a complex series of reactions, which hopefully we can get into next time. But,
Sure.
That being said, the way that it works is, you're right, it's not magical. You have to actually still exercise. It's like protein in that way, in that, if you just eat a ton of protein, you're not going to magically get strong. You still have to do the strength training. So same is for creatine, that you just need to, add it into your diet or as a supplement, and then continue doing the strength training, and you should see some results.
Gotcha. And real quickly, I think the thing people need to think about in terms of creatine is what it is. It's in your muscles already. And it creates energy for the muscle cell, so allowing the muscle cell to contract. Is that right?
That is right. Yeah. So it just kind of modulates, a little phosphate group, and lets your muscles contract a little bit stronger with a muscle contraction. So that'll over time, recruit more muscle. Yeah.
But you burn through it real quick, and that's why the bodybuilders or athletes like to use it, is because they're able to do a little, as they burn through their creatine. If they supplement with it, they have more available in their muscles, and they can do maybe a few more reps, and that's how they build muscle. That's basically what it's doing.
And it's either, they can also push the weight, right? So they can, over time, what they're doing is they're actually challenging their muscle groups, increasing the blood flow, right? And they're getting more muscle cell recruitment. So remember at the beginning, we were talking about aging and how aging causes muscle cell loss. And so creatine and protein and strength training can all do the opposite, which is to help to recruit more muscle cells over time.
So the main takeaway from the day is essentially muscle loss is something we should start thinking about in our 30s, and people should think about maybe adjusting their diets, particularly in relationship to protein. People need to think about exercise and perhaps supplementation. Those are really the three things you would say to think about as you get older for keeping your muscles strong and staying active. Does that sound?
Absolutely. I think those are great takeaway points.
Okay, great. Excellent. So thanks, Dr. Albertson Nye, for telling us all that. That's awesome. And thank you for joining us for this inaugural episode of the Why Act Your Age podcast. Next time, like I say, we're going to talk more about creatine specifically, and why Dr. Albertson is one of the number of medical professionals who are starting to think about how it's important for keeping muscles strong as we age. Until then, don't forget you can subscribe to the podcast, and you can also find Dr. Albertson's videos on topics around athletics and staying active by visiting boneandmuscle.com and clicking on our videos tab. So thanks, and we'll talk to you soon.